Awesome. Today we're met with Dr. Cuyler. Thank you for jumping on here, Dr. Cuyler, and we're going to talk about Freespira today. So if you don't
My
mind,
pleasure.
if you don't mind, just do a quick little intro of who you are, and we'll dive right into it.
Yeah, I'm Bob Cuyler. I'm a clinical psychologist. I'm the chief clinical officer of Freespira, which is a company which offers an FDA-cleared digital therapeutic for the treatment of panic disorder, panic attacks, and PTSD.
Nice. In Freespira, and what is that?
Well, Freespira uh, is actually classified as a medical device which incorporates measurement of one's respiratory physiology and uses information about that respiratory physiology to teach people with these conditions, panic and PTSD, how to normalize their breathing. And I'll have to put in the mix there, count varies day to day, but 20 to 30,000 different wellness apps out there in the world. But ours is really a specific approach for treating these panic-related conditions, including PTSD, that have dysfunctional breathing, dysfunctional respiration as part of the mix. It's certainly not a cause. These are complicated conditions, but it's an ingredient that is involved, but also gives us a different kind of avenue for treating these conditions beyond the traditional talk therapy and medications as first line treatments.
Right. I was really drawn to this because I find breathing really important. If I'm either triggered or even just irritable, I notice that my breathing gets short. Sometimes I'll hold my breath,
Yeah.
So what is it about the breathing technique and just ballpark, like how long is this process for Freespira? Like, and I guess we'll get to like what inspired it.
Yeah, interesting. The background is really fascinating. So beginning about 30, 40 years ago, some really bright scientists started looking at panic attacks and really delving into the physiology of panic attacks and really looking and finding such a powerful connection to breathing, subtle breathing abnormalities in panic. So as you mentioned, holding your breath, breathing too fast, breathing erratically, yawning, sighing, all of those are these really kind of subtle respiratory squiggles, if you will, that's associated. For some people, they're kind of in play all the time. For other people, they really kick in when you're anxious, when you're triggered, when you're stressed. So out of this conceptualization really came a recognition of the importance of the balance of carbon dioxide and oxygen in the system. Everybody kind of goes to a notion that we all need oxygen and you breathe deeply in order to calm yourself down. Well, if you have these conditions, deep breathing, which means kind of over breathing or hyperventilating, kind of sets your physiology outside of the normal range. And we think plays a role in the risk factor for people developing panic or PTSD, but also may really kind of aggravate the surge of symptoms that people feel when they're triggered. So out of this conceptualization, a group out of Stanford and Southern Methodist really kind of developed a protocol, which we still use today, that teaches people how to slow down and stabilize their breathing, but also how to normalize their CO2 levels, which you have to measure with a piece of equipment. The group out of Stanford used what's called a capnometer. These things are used in the ICU. They're used in anesthesiology to really kind of determine this balance of oxygen and carbon dioxide. And they developed this protocol for teaching people over the course of a month how to slow down, how to stabilize their breathing, and how to optimize, in other words, to move their CO2 level, if it's low, back into the normal range and learn how to hold it there. And lo and behold, they found that people who did this with long, long histories of recurrent panic attacks got well very rapidly. And what was amazing to me is one, how rapidly they got well, but also that their clinical improvement was measurable out to a full year after this, after they were no longer using this technique. And I have to tell you, as a practicing psychologist, I'm pretty darn good, but I have yet to get somebody with recurrent panic attacks well in a couple of weeks using talk therapy.
Right. Yeah, no, I'm not a big fan of talk therapy either. So I'm always looking for alternate options. And this seems like a really good one because I think breathing's important. How does someone get involved with this? Like how do you request a piece of equipment?
Yeah. So I'll give a little bit of backdrop. So we're an FDA cleared intervention, which means that we had to present research on safety and effectiveness to the FDA. And the FDA determined that, one, we're a safe, low risk intervention, but you have to be recommended or prescribed by a licensed healthcare professional in order to do it. So because of the safety, practitioners like psychologists like myself or social workers or counselors, in addition to physicians, can prescribe this. You don't need a medical degree to prescribe it. Mm-hmm. And once we get that prescription, we send the system to the individual's home. They are paired with a coach who are part of our team who teach the people how and why to use it. They observe a first session. Many times we observe the kind of funky breathing that we're trying to stabilize while we're watching that person on a secure Zoom call. And so that coach then follows that person through 28 days of use. We recommend it be used twice a day. It's 17 minutes per session. And both the individual user and the coach have access to all of the data from the session. So our company secure server is connected to a little tablet computer, which essentially plays the 17-minute session to the patient. So we're recording all of their breathing characteristics. We also have symptom questionnaires. So we're able to kind of see the severity of the condition before we begin, but we also track whether their symptoms are coming down over the course of the use. And so over those 28 days, the coach is following the individual. They are, kind of explaining the rationale. Every now and again, people get fairly mild but unpleasant side effects like a sensation of air hunger or not being able to get enough air, because paradoxically, often we are teaching people how to get comfortable with breathing less rather than breathing more. That's, I think, in a way, kind of what sets us apart from so many other kind of breathing wellness or meditative traditions. And I'll pause there and see where you'd like me to go next.
Yeah, I was just thinking while you're talking about that, like, what apart CO2, like is it high? When CO2 is high, is that when the panic attack will start, or when it's low? Like how are we measuring it? And I was just curious, like what's happening inside the human body that causes these panic attacks?
So one of the things from that original theory that I talked about that started happening about 30, 40 years ago, the scientists working in this area begin to kind of focus on some individual characteristics. And to put it in layman's term, people that really freaked out by sensations of shortness of breath, and they react to sensations of shortness of breath by overbreathing, which then moves their CO2 low. So the basic theory is that a high CO2 environment, which you can do by holding your breath, right? And anybody who does that for 30, 40, 60 seconds starts to feel distress, and your reaction is to breathe and to overbreathe. And that kind of process goes haywire in people who are at risk. And they tend to, not everybody, but they tend to have low CO2 all the time. And we think that this kind of sets the stage for the triggering of symptoms when people are stressed. And so by giving people breath-to-breath feedback of their respiratory physiology, so the individual breathes through a simple little nasal cannula, we're measuring their CO2 levels relative to oxygen. And by looking at that and essentially playing and experimenting with different breathing styles, you learn to kind of move and hold your breathing in that normal zone. And what we teach is what I call diaphragmatic breathing. A lot of people, when they're stressed, you can see their shoulders heaving, they're breathing with their upper chest. essentially they're using their wrong, the wrong muscles.
Right.
So we teach this diaphragmatic breathing, but you get feedback that tells you whether you're in the zone or not, which is what's quite different from other breathing traditions that don't have this measurement of your actual physiology.
Yeah, no, I think that's pretty exciting because a lot of times it's more like how do you feel? Like how like you're judging your breathing, whereas this brings a little bit more science into it, where they're actually measuring the levels of oxygen and
Yeah.
CO2, which I think is pretty cool. There's something you spoke of last time we talked that I thought was really neat, and it was stale breathing can trigger panic attacks, as well as you guys noticed in PTSD, it can trigger symptoms like flashbacks and things of that nature. I was wondering if you could
Yeah.
speak to that a little bit.
Yeah, so really interesting. There was a technique that was developed in the lab called a carbon dioxide challenge test. CO2 challenge test means giving individuals essentially a whiff of high CO2 air. We call that, we can call that stale air. It would be like what would happen if you held your breath for a while. Your CO2 levels would go up in your blood, and also it changes the acidity of your blood. And so what was fascinating is, as this research began, the researchers discovered that a single gulp of CO2 enriched air precipitated panic symptoms in most people who have panic attacks. It precipitated panic attacks in a lot of close relatives who don't have panic attacks or panic disorder. And then there was an extension to PTSD, which was also fascinating. And researchers found that this technique not only triggered panic attacks in many PTSD sufferers, but also the people taking in this single gulp of CO2 enriched air sometimes had immediate traumatic flashbacks or memories and dissociative symptoms. And so isn't that fascinating? A lot of times we think about trauma equals PTSD. Well, numbers may vary, but somewhere in the ballpark of 20% of people who were exposed to severe lifetime trauma develop PTSD. And there's a lot left to learn, but there's good reason to believe that there are some genetic risk factors that are associated, as well as, lives that have cumulative trauma, particularly trauma starting early in life. Those are some of the risk factors, plus exposure to a later in life trauma that really culminates in somebody developing PTSD. So here, I'm going to just kind of make a little segue. This relationship between panic and PTSD is really not sufficiently recognized. But when you look into the scientific literature, we find that depending on reports, about 60 to 75% of people with PTSD have some degree of panic symptom in their PTSD symptom mix. What's interesting is that for people with PTSD, those panic symptoms tend to be provoked by traumatic reminders. So that may be if you take somebody with PTSD who is really disturbed by being in crowds and people all around him, that sixth person who gets on the elevator may all of a sudden be the trigger that sets off that surge of symptoms. And those panic symptoms, which are racing heart, chest tightness, sweating, tremulousness, feelings of loss of control, or feeling kind of being outside of yourself. So there are a lot of panic sufferers where these symptoms just seem to come out of the blue. But for people with PTSD, they tend to be associated with memories or exposure to triggering situations.
I'm glad you did that. It was on my next question, was like to break down what a panic attack is.
Yeah.
If someone is having a panic attack, what are some other things that they could do to maybe help that moment at the time if they don't have this equipment?
Yeah, that's an interesting one. They're really not reliable techniques for interrupting a panic attack in process. The idea of breathing into a paper bag has kind of been debunked. The other thing to remember is that panic attacks tend to be self-limiting. They last 10 to 20 minutes. And so it's very confusing to try to say, well, introducing some technique that for a symptom that's going to go away in 10 minutes, it's hard to tell whether it was going to go away on its own or whether the treatment, like the paper bag, had anything to do with it. There are a lot of people with panic attacks who rely on benzodiazepines, and they work pretty darn well. But the problem is that they can be habit forming. There's abuse potential.
Yeah.
They are dulling for people who get older. They increase risks of falls. I think one of the things, unfortunately, that sometimes people learn that the way to manage is to avoid situations that are triggering. And in a way, it makes perfect sense. But then what happens is that the avoidance behaviors start to take over. So, somebody, I worked with an attorney once who was in fabulous shape because he freaked out on elevators. So he climbed the stairs every day, right? So the limitation in his life is that he no longer had an option of riding the elevator. He was intensely embarrassed, by not being able to ride an elevator with other people. Interestingly, he had airplane panic, but what freaked him out was when the plane either pulled away from the terminal and stopped or landed and then didn't go immediately to the terminal. So that would be the trigger for him. And again, he would have these surge of physical symptoms, and he was intensely embarrassed by essentially not being able to keep it together, while he's sitting in a plane in an absolutely safe,
right.
Rationally, we can say absolutely safe circumstances.
Right. I also found I did the whole avoiding challenges or just uncomfortable situations. And if anything, it made it more sensitive. When I did go out in public, I was more sensitive to being triggered or provoked or just being uncomfortable. And on the spin zone, I started doing a lot more things, I guess, over the last 2 years that are very challenging. And it seems the more challenging of the things that I do, the less impactful small things like going to the grocery store used to be for me. So
so you were intuitively doing what us psychologists call prolonged exposure or systematic desensitization. And so what you were doing is you were challenging your brain because your brain is giving you a deal. What your brain is saying, look, all you have to do is avoid being in crowds, and I'm not going to make you terrified. Deal? Mm-hmm. Right. So you start doing that, and what happens is it starts to spread. And all of a sudden the brain says, well, okay, let's go from, you're not going to go to that concert you really want to go to. You're going to avoid getting on elevators. You avoid being in all kinds of circumstances. A couple of months ago, we wrapped up treatment with a veteran. And we don't really go into people's history, but his comment at the end of his very successful treatment was so moving. He said, my daughter is 5, and I took her to the movies for the first time in her life. Oh, for him, that was the marker of his progress. And, we can maybe overinterpret a little bit, but it's not much of a stretch to think that, this gentleman who was a combat veteran, the bravest of the brave, could not bring himself to be in a dark place with strangers for 2 hours. And so for him, the marker of success was his ability to challenge what had been a triggering situation. And what we find is that people begin to, as they get some confidence that their symptoms are starting to settle, but they also feel like they have a tool now, that they start to take on things that they would usually avoid. And when one situation, to their surprise, is now manageable, they start to take on more things that they've been giving up and find that the confidence builds that they are now able to do things that they've been avoiding. Because it's, panic attacks, symptom surges are terrifying, they're debilitating. And then what gets depressing and embarrassing is that you're constricting your life in order to manage your symptoms. And so, one thing that I always like to stress with Freespira, we are teaching people how to change their respiratory physiology, but we're also teaching people a self-management skill. What we also hear spontaneously for a lot of folks is, I was in a triggering situation yesterday and I breathed my way through it. And what that really kind of conveys is, at the first little glimmer of what would have been kind of a cascade of symptoms that runs out of control, people are now kind of nipping it in the bud. I think not only by kind of normalizing the respiratory physiology, which is kind of like an ingredient in the symptom surge, but they have a sense of mastery or control, because in both panic and PTSD, a sense of lack of control is really profound. That's one of the things that's really debilitating and demoralizing about these conditions.
Yeah, when you said that, it really jumped out at me. It gives them control, in a panic
Yeah.
attack and being triggered, you definitely feel a sense of loss of control. So getting
Yeah.
that power back and feeling like you're doing something that is positive, like that's got to be pretty awesome feeling, especially if you've been feeling that loss of control and like, oh no, what, not again? Like, what do I do? Kind of
Yeah.
feeling.
Yeah.
I was talking to a psychologist in Ukraine. She mentioned meditation. If you're in a panic attack, meditation may not be the best bet, because you might you get in your head, and like it just kind of compounds, expands, could get worse. And she's like, if you do try to do meditation where you're touching your body. You're like, where you squeeze your arms, squeeze your legs, and feeling present, because it brings you from that reptilian side of the brain to like
Yeah.
your present moment. And I was like, oh, that's pretty cool. So I imagine doing that with this breathing technique might be extra beneficial. I don't know. I was just curious and expounding, but
Yeah. So let me
go
give you
ahead.
a thought about that. One of the things I think there's a kinship between what she told you about is, I think both techniques are teaching individuals how to have a more friendly relationship with their body.
Right.
And when you have a fearful relationship with your body, let's say, oh my God, it felt like my heart skipped a beat, and oh my God, I'm getting scared now, my heart is skipping more, now I'm breathing fast, I'm short of breath, I'm trembling, I'm sweating. You have that fear-based relationship to the body that starts to gallop out of control. And so what we teach is really, I mean, we don't teach it like in a formal fashion, but what we are kind of getting at is, that sensation of shortness of breath. Yep, that goes with your condition. And you know what? We're going to teach you how to master it. And what I often say when I'm working with individuals is, you know what? If you wanted to get in better shape, or you wanted to participate in that charity fun run, and you run around the block for the first time, what are you going to experience? Well, shortness of breath and sweating and feeling like I can't catch my breath. So, yeah, exactly. And if your goal is to run in that fun run, that shortness of breath is a sign that you had a good workout, right? So it's a friendly way that your body is saying, "Wait, I had a good workout." And if you treat that shortness of breath like a signal of danger, and you sit on the couch instead of getting in shape, you're not going to do that fun run. It's going to get in the way of your goals. So if we have people who gradually get used to the discomfort that they feel in their body and understand that it's something that they can master by really learning how to master their breathing, you put a different framework on the body. And so when you have an awareness that, oh, I'm holding my breath, I don't need to do that.
Mm-hmm.
And you shift into, what people say is they are aware of their breathing getting out of sync, and they know how to stabilize it. So one of the things, I don't think I mentioned this, when you're doing the exercise, your job is to synchronize your breathing to a rising and falling audio tone. So you breathe in as the tone is going up, you breathe out as the tone is going down. And my very first patient, a couple of weeks in, said, Doc, not only have my nighttime panic attacks gone away, but he said, but when I'm getting stressed, I can hear those tones in my head, and I stabilize my breathing to those tones. So in other words, he has kind of internalized the skill that we're trying to build. I kind of describe it almost like the training wheels on the bicycle. After you learn how to ride You don't need the training wheels anymore. So that's one of the reasons why we have a 28-day treatment. We're not involved in, selling people a piece of equipment that they use for the rest of their life. It's basically to use the technology to teach a skill that you then own and you use when you need it. So if you find that you're holding your breath, you find that your heart felt a little, a little sensation of a skipped beat, that you know what to do now, that you stabilize your breathing and the body kind of stabilizes. And when that surge of symptoms doesn't happen, then you develop a confidence that you have a mastery over your body that you didn't have before.
Exactly, the confidence part. You seem really passionate about what you do. What got you involved in mental health, and do you find it as rewarding as it sounds like you do?
Yeah, great question. So when I was a kid, I loved to read. I loved literature. I think English was one of my favorite subjects. And I got really interested in what made people tick. And as I got into college, I continued to love literature. But in my first psychology classes, that was kind of an understanding really based on research about how people learn, how people think, how people remember, their relationships to emotions. And that's what really got me interested. And then being in a field where I could take that scientific basis and use it in the real world by working with people who were struggling with their psychology. That's really what kind of got me going. And I got very interested in different ways of delivering care in the course of my career. So I've had a really quite a varied a career over time. I got involved in telemedicine, using technology to bring mental health services out to rural communities where they weren't available. And it was that interest in technology that got me introduced to Freespira. So I'm an experienced clinical psychologist and talk therapist. I've been doing it for decades now. And the CEO of the telemedicine company that I was consulting with called me and said, "Bob, I learned about this breathing thing. Would you take a look at it?" And I said, "Well, sure, why not?" So I had a chance to read the scientific literature, and it was fascinating. I really knew very little about respiratory physiology, but then reading this research out of Stanford that showed people getting well in 28 days, that was just unheard of. Many people, if not most people with these conditions, learn how to live with the symptoms as opposed to resolving them. So here was this interesting scientific literature. And I happened to have a couple of people in my practice who kind of fit the profile. And I asked them, "Are you willing to be a guinea pig?" And my very first patient, he was the guy that I said a minute ago, was having these horrible panic attacks in the middle of the night. And he would wake up in sheer terror, unable to get back to sleep. He was exhausted, the next days. And he said, "Sure, I'll give it a try." I have to tell you, as a psychologist doing talk therapy, trying to approach somebody who's having panic nightmares is quite a challenge. There's no, well, what were you doing before you had the nightmare? Well, I was sleeping. And then all of a sudden, and this gentleman in 2.5 weeks was basically panic free, which was astounding to me.
Wow.
And in 4 weeks, he was basically done. And like you described yourself, he really didn't have a particular interest in talk therapy. His life, apart from his headaches and his panic attacks, was in pretty decent shape. And in 4 weeks, he was done. He was gone. And the neurologist that referred him to me 2 years after said, "Yep, he's still doing fine." So for me to have a new intervention that was based in intriguing science and was distributable via technology to bring it to the world, that's what got me involved. And then I had a string of patients who had very similar outcomes. Now, I have to tell you, it's not a miracle. About 20% of people, don't have a positive response. Right. We have seen nothing. So there are about 20% of people. We still don't really understand why. About 20% of people are non-responders, but percent positive rate is pretty darn good in my field. So For me, it was sort of an intersection of novel technology rooted in science, rooted in evidence, and in, kind of a kinship to the technology telemedicine world that I was a part of. That's what really got me involved with the company almost 10 years ago.
That's awesome. I'm going to add it in the show notes and have links provided to anyone listening. But I was going to ask you, where do we go to get more information about Freespira?
Yeah, our website, freespira.com, will have a lot of information. We have links to our published research. We have information. One of the things that is a challenge to us is that we are a really kind of new way of treating. We're not a talk therapy or a med. So we are working diligently to really try to get coverage by insurance plans. We're making some headway. We are available in the VA, but we are having to go kind of doctor by doctor, VA center by VA center to get approval for the treatment. But it is payable via the VA. We're available in some plans in the East and the Northeast, some in Wisconsin. It's available as a self-pay intervention. It's not a $1.99 app store upload, because you've got all the significant technology that we develop, manufacture, and send out. But availability would be available for our website, as well as a customer service representative who would kind of talk you through, one, does it look like you're a candidate for this? How we would range, for your doctor or people who were contracted us to review your condition to make sure that, that you fit. We're not for everybody. We're not a wellness app. There's no good reason to believe that we would be helpful for somebody who only has depression or who has obsessive compulsive disorder, things that are related to panic attacks or PTSD, as per our research and our FDA clearance, are really where we concentrate.
Okay. The next question will be one of my last ones, but med free. I keep hearing that phrase almost every website or video that I've watched of Freespira. And I was just curious, you can go as deep or as shallow into this as you like, because I know it can be kind of polarizing, but what's your feelings on medication?
Yeah, great question. So I mentioned a little bit earlier that benzodiazepines almost work too fast and are too effective. I mean, they really kind of relieve anxiety almost immediately, but they are, significant risk of overuse. And essentially, they suppress symptoms as opposed to addressing symptoms. There's good research that antidepressants can be effective. Interestingly, for both panic and PTSD, exposure-based talk therapy and antidepressants are the approved treatments for these conditions. And for people for whom medication works, they're terrific. The complication with the antidepressants is that they are slow to work. Typically, it's 3 to 4 weeks before there's, typically any reduction in symptoms. And unfortunately, in the first few weeks, there's a high side effect burden. And what happens is a lot of people who take antidepressants really can't tolerate the side effects. And interestingly, there's in the scientific literature some indication that people with panic attacks are even more prone to side effects than people with just depression. And again, it's that hypersensitivity to bodily discomfort. The other thing that can be complicated is that it's very hard to wean off of antidepressants. For many people, they end up having to take them for decades, because when they stop, the symptoms return, which happens typically within 2 to 3 years. Even symptoms that have been perfectly under control will tend to emerge again. But also sometimes people have a great deal of discomfort as they taper off of medications. So, I work with people who have taken medications and have done fine, and it's an absolute fit for them. Others are referred to me by their psychiatrist because they're symptomatic again, and they do not want to get on a med. So I really kind of, there's not a competition. I really kind of see what we do as adding tools to the toolkit that help offer choices to clinicians as well as individuals about the kind of treatment that best fits for them. And actually, I want to segue for a minute. I talked about, my being a talk therapist, and you kind of said, yeah, I'm not too crazy about that. Well, it turns out that a lot of people are not. We do an awful lot of good, but we're not a good fit for everybody.
Mm-hmm.
I think some people just by nature have the challenges of kind of opening up their life to somebody else.
Mm-hmm.
And in addition, the best evidence for therapies for PTSD and panic are exposure-based therapies. And that's a very hard sell, because what it means is that in the course of your therapy, you're going to be gradually exposed with guidance to the things that terrify you.
Mm-hmm.
And consequently, there are a lot of people who don't avail themselves of prolonged exposure for PTSD, or who start it and then drop out because the re-exposure to their traumatic memories is more distressing than they can tolerate. So when you look at the literature for the best talk therapies for PTSD, dropout rates are typically measured at about 40 to 50%.
Mm-hmm.
So the people who can tolerate it, it's a terrific therapy, but about half of the world, half of people with PTSD or panic either don't engage in or can't tolerate the therapy. And so as much as I think us psychologists are wonderful for folks, there are a lot of folks who don't want what we're selling because it's a therapy that it's not a good fit for them.
Right. I noticed for me, mine's complex PTSD, and when I start addressing an issue with one, I can't separate the one from the others.
Yeah.
And when that door opens, it gets like, I don't realize I'm overwhelmed. Like logically, I'm still there. Cognitively, I'm still there, but emotionally, I shut down.
Yeah.
And it's almost instantly. Last time that I tried, it was almost 3 days. And
Yeah.
I do not like being in that state of numbness. I spent years in that state, and I'm like, no, I'm okay. And I just go back to coping instead of, I guess, processing. But that's where I'm at the moment. Maybe one day I see that there's a lot of research with MDMA, psilocybin, and talk therapy. I think that would be a really cool combo, because I could see how that would desensitize a person or allow you to like separate yourself from the pain and just be processing it. And that would be a cool process, but we'll get to that.
Fascinating research.
I know, it's really cool.
Yeah. I think that, to be able to take things that have been classified as illegal drugs and make them available, there are a lot of challenges there. Mm-hmm. And one of the challenges, as much as I am in favor of these new developments, I think one of the things that's going to be a real challenge is that these treatments at this point are not very scalable out in the world. So in order to do psilocybin-guided therapy, you need a really well-trained mental health professional, in some circumstances too, with you for an 8-hour stretch. And there are not enough of us to go around. And when you figure that there are about 1 million veterans in this country who have PTSD and about 10 million civilians, how are you going to scale these treatments so that they are reachable? And I have kind of concern that they may end up being very specialized and accessible only in certain circumstances, or they become kind of boutique treatments for people who are wealthy, who can afford to do it out of pocket. I hope the research goes on. I hope the research is going to find cousins of MDMA and psilocybin that are effective without the trippy aspects to it, that need guidance, or that don't have abuse potential, because you figure MDMA was, a party drug with great abuse potential. And, how do you safely turn that into a mainstream treatment?
Exactly. It's almost like pulling CBD out of marijuana and like just having the positive body effects opposed to like the mental of THC. Yeah. No, hopefully they do get to that. That's all my questions. Is there anything you wanted to touch on before we wrap this up?
I think one of the things that has really kind of heartened me. I really felt like in some ways that my field had kind of stalled out for a period of time, that the pipeline of new medications had really, they were mostly kind of me too drugs for depression and anxiety and schizophrenia, that, there was a lot of development going on in talk therapies. But, we see in our country, just more and more data that the burden of mental health issues are going up rather than down. And it's heartening in the last 5 years or so that there is really work on decreasing stigma, on recognizing the importance of mental health care, making it accessible, and an openness for new treatments that are outside of the kind of old traditions that had, in my book, kind of stalled out.
Right. No, I agree. Well, Dr. Bob, it was awesome. I really enjoyed talking with you. It's such a delight. And with that, I'll wrap it up. Thank you so much.
Thank you so much, and a pleasure visiting with you today.
Oh, you too.